it's Dr. Amanda with StraightSmile Solutions, StraightSmileSolutions.com, and today I'm going to talk about collaborating with an ENT. What is an ENT? An ENT is an ear, nose, and throat physician. So dentists can collaborate with ENTs on cases. Now, the sequence of appointments and events and the referrals really depends on how you guys get your groove on. So, it's a matter of getting to know your ENT and knowing what they want. So this is how I would get started. So there's some great ENTs out there, and there's some really old school, closed-minded ENTs, and it's a matter of finding the right ones. So don't be frustrated, because I find a lot of younger dentists are very open-minded, very proactive about airway, about treatment sequencing with orthodontics, and wanting to collaborate with ENTs, but the vast majority of ENTs are quite closed-minded and are not at all interested in collaborating with the dentist, nor are they interested in hearing what you have to say. But there is a small subset that is. And for the best outcomes for your patients, you need to find that doctor and hold on to it. So my suggestion is, if you're going to get started, especially with phase 1 or interceptive treatment, you want to do a big deep dive into the ENTs in your community. This is a great way for you to get referrals. It's also a great way for you to help your patients and to find collaborative physicians to support your treatment plans. So I would go ahead and just send out like an introductory letter on letterhead, to every ENT in your community. Hey, I'm Dr. So-and-so. I'm a dentist who has a special interest in interceptive orthodontics. We all know interceptive orthodontics is greatly, our fields overlap. It's definitely related to, ear, nose, and throat. And we might have some patients that we need to collaborate with. So I wanted to know if you're interested in collaboration, if I can send referrals your way, and if you'll be willing to, collaborate on patients for their best outcomes or something like that. You could definitely say it. I literally just shot that off, but, I'm sure you could say it a lot better than that. You might send off 20 letters on letterhead and you might get one response, but at least, that doctor's interested. Is like, hey, that's cool, definitely interested. Even if you don't get any responses, in terms of collaborating, the way, if you're doing an exam on a patient and they need expansion and you're taking a look and you see swollen tonsils, definitely see airway issues, you see SDB issues. First of all, I'd recommend you have an SDB screening form and have the parents fill that out, because the more data you can give the ENT, the better, right, to support your idea. It's kind of which comes first, the chicken or the egg thing. Do you send the patient to ENT first, or do you do the ortho first? I like to defer to the ENT, because as much as us dentists think that we're oral physicians, the ENT is higher than us. That's just the hierarchy, okay? Because they are much more trained oral physicians, So we have to think of it that way. It's kind of like the military. We defer to them. So usually if I have a patient that I think has a severe airway issue, I'm not going to start ortho first without the ENT's blessing. Not unlike I wouldn't start an ortho case if a patient had, issues with their perio or their, infections in the bone, like I would send the patient to the specialist first and get their okay. Do they treat that first, or do we do the ortho first? Get that in writing. So send to the ENT first. Sometimes depending on their insurance, you're going to have to send to their primary care physician for the referral to the ENT. So this can take time. And I know a lot of times we don't want to lose that start, but it's the right thing to do. So, because sometimes they're not going to tolerate the appliance if they don't have the airway so that they can breathe with a bulkier appliance in. I mean, we don't want to put danger to the patient. And a lot of times the ENT doesn't want to do a surgery if they have a fixed appliance in, right? We could start a removable, but if they're doing a surgery, they're not going to tolerate it during the surgery recovery period. So you're going to have to remake it at an additional cost. So best to figure out the sequence of appointments if they're going to do a surgery. Now, from my experience, when they've had surgeries, if they're a mouth breather and they do a surgery, it's just going to relapse most of the point. So a lot of ENTs get that. So it's a collaborative thing. They do the surgery, they recover, then you start the ortho, right? And they're being seen by the patient. And hopefully, if all the cogs turn in the right direction, this patient should be cured and be much improved with your collaborative interdisciplinary treatment. So again, send to the ENT first if you have concerns, defer to them. Sometimes they're going to blow you off. I mean, 5 times out of 6, they probably are going to blow you off until you find the right one. It's okay. Just get it in writing. All you want is that it's okay to proceed with orthodontic treatment or surgery isn't needed. That's all you want. You want that in writing, and then you can sleep well at night, knowing that you at least consulted with the ENT. You know, you might still think that they need the surgery. But you know what? After you do the ortho, you can always try one more time, you know, especially if the patient is still having airway issues. But at least you tried. So that's just my thought on how I would do things. But of course, once you find that ENT, you defer to them. All right, thank you.